Hello and welcome. Today I'm so delighted to introduce my guest, Karyn Bender. Welcome to you, Karyn.
Hi, Bev. Thank you.
So today we just want to get to know you a little bit better. So tell us more about yourself and what it is that you do.
I do a lot of things. One of my, I'm going to say, incoming gifts in this world is my intuition, and more on the side of medicine. People have referred to me as a medical intuitive, but I also study a lot of what we call modern medicine. I love pharmacy. I love chemistry. Really love chemistry. It tells me a story. A lot of times I can see the chemistry in people's bodies and what's happening. So yeah, and there's a lot of added extra around that too. Which we can explore.
Yes, so when I first heard about you and met you, one of the things that you were doing was quite outside of intuition. So tell me more about that part of your job and your life.
Yes, I'm clinically trained as a pharmacist, and that's the part of the chemistry that I absolutely love. I love looking at the chemical structures. They tell me a story of what's going on in the person's body and either the herbs or the modern medicine themselves. Chemistry is everywhere. So we can really tell a lot from that story and what's happening. And I really believe that the modern medicine and the intuitive medicine and the healing arts all play a piece together. So that's why I really went into that work. I understood as a 12-year-old girl who was menstruating. I had this wonderful little tablet in my hand. At the time we called Nuprin. It's an ibuprofen. And I was curious as to why, when I swallowed that pill, how come it not only helped my cramps, but it also helped my headache. It helped my mood. It helped me feel better. How did that happen? Fascinating. So that really started me on my journey with medicine, modern medicine and pharmacy, and actually even food. How do the nutrients get everywhere in the body? And then I could see it in people also. I knew when I was younger, I started to learn when I was younger, that there were images around people. There were what we call as energies around people and things that I just knew. And putting all those pieces together over a lifetime.
That's really fascinating. And I guess as a young girl, did you know that this was a special gift, or did you think it was really quite ordinary?
I had no idea that this was something a little bit different. And I really feel like a lot more people are tuned into this than they may want to trust or believe. But it was something that, I just thought everybody saw, felt, heard, thought, got information the same way I did.
Wow. Okay.
Yep. It was ordinary to me.
And you used the word in medical intuition. So can you just describe what that is?
Yes. And for myself, there's different, I want to say like different types of intuition, but the medical part of it comes clearer and easier for me. Seeing the person's body in its physical form, but also in other messages, like the emotional body that's happening. Some people might say like the soul and the spirit work that's in there. So more of like an esoteric phase. When I am reading for someone, I ask 3 questions of them, of their body. And, for me to tune in is what ails them, what will heal them. And the most important thing is, what do they love? it's connecting with that inner peace in their body, or that inner joy in their body, and finding out where it is, where it's not, where it's stuck, and starting to develop their healing pattern from there, or trying to discover maybe what's wrong that modern science isn't seeing. Mm-hmm. So it's definitely, that's why I refer to it as medical intuition. So it's a more, I want to say it's a more narrow field in the reading. Mm-hmm.
So you described there that it's at the physical layer, the emotional layer, and a spiritual layer, and you're looking basically for root causes that may not have been obvious. But I guess there's also people that may have come with a diagnosis already, so so you would probably have people in both those parts of the continuum. And so what are some of the benefits of working with a medical intuitive?
That's a great question. I often have people come to me who will say to me they are stuck. They don't know what's wrong. They have symptoms. They may have gone to multiple practitioners, multiple healers, and they are feeling as though they don't have an answer yet. I feel like the benefit of medical intuition is it brings all of that in together. I'm looking at them like a human MRI. And most of the time, we can pinpoint areas. There have been times when I'm blocked. I'm not allowed to see what's going on. Either the patient is blocking me, or whatever they need to experience in their life, it's blocking me from seeing them, from reading them. And that's okay. That's happened. So we figure out how, if we can unblock that, and if not, where can I guide them to from there? What am I feeling? That's when I can bring in my modern medicine pieces to see where's a good way to guide them from there. But I feel like when you're working with a medical intuitive, you are working and looking at steps beyond lab work. You're looking at steps beyond numbers. You're looking at a deeper picture. We're going deeper. I don't know if any of your audience ever read, or maybe their kids, or I don't know if grandkids, there was always this set of books that my kids looked at called the Magic School Bus. And the teacher took these kids on a ride through a magic school bus. Sometimes when I'm working with younger people, but I typically don't work with kids, that it's like a magic school bus ride through everything. So if you're a kid and you remember seeing that with Miss Frizzle, that's kind of what it is. And then other times it's head to toe. It's an image that comes up, and sometimes it's definitely more specific. It depends on the person, how I have to approach what's happening with them. There have been times when I'm doing what's known as a shamanic journey, and I'm going in that way to figure out what's going on in their body and what needs healing and where. And the interesting thing is, like, I rarely get something that comes up and says, oh yeah, you know what, you've got type 1 diabetes and here's where it is, and that's what's going on. I will get other images and a story about their body and let them know where there's blocks, what I'm seeing, what's happening in there, and we then dig deeper.
Yeah, so it's also in the unfolding, Karyn. So you getting the image or the symbol, and then through exploring that with the person, you getting to the next layer, right?
Correct.
Okay. So then at a high level, can you just sort of explain how typically you might run a session? You know, does somebody need to have a belief system? Do they need to, you know, be open? You know, I'm just interested in a method at a high level.
Yeah, they don't necessarily have to have a belief system of any sort. They have to be willing to be willing, or even willing to be willing to be willing, and be open to hearing and experiencing what I'm going to come through with. And that's pretty much it. Most people that come to me are pretty willing because they're done. They can't figure things out. It's not often that I am approached by somebody who hasn't talked to other professionals first. And I've helped out some doctors who have called on me to read on a patient with the patient's permission, because they're stuck and they can't figure this out. The patient's having symptoms and yet nothing is showing up anywhere. And there might be a little bit of tweak in their blood work on something, but yet they're experiencing more extraordinary symptoms that are real, not psychosomatic symptoms. So yeah, but other than that, like if people are concerned about like religious belief systems or anything like that, not even tied. So yeah,
because I guess that if doctors were open to that kind of collaboration, then it's person-centered health, really, you know, for the individual. So that sounds promising that you do have some doctors who are open to that, because my personal experience is that I was basically painted as a liar and a hypochondriac because they couldn't put my symptoms into a neat box of a diagnosis label. And so, you know, I did end up with a label of chronic fatigue because that was one of the presenting symptoms. But the way that people sort of in that process, and I eventually just stopped working with external practitioners and started to do my own research.
Good.
And that led me to the right people to help me unpack what was really going on. You know, I had a chronic infection, which was actually not even that obvious in the bloods because I did have a low white blood count, and they said, well, that's not sign of a chronic infection, but it actually is because there's nothing left in the body to fight, you know, so there's those kind of things. So it's really helpful that you can take either somebody who's, working towards whole health, complete health because they know they've got something, or someone who's just, probably like if I had have met you all those years back, I would have felt such relief. So can you tell me some of the outcomes, if you think of particular people and where they started and where they ended up as a result of, using medical intuition?
Yeah. A lot of thyroid patients will come to me and we'll try to work through that chakra, but there will be other things going on in their body that they might not be aware of. So that has come through. I have had a couple of patients that have, or I shouldn't say patients, people that have come to me that have had discomfort in particular areas. And I've seen some stagnation in there. So I would need them to really have, biopsy or go a little bit further into that. The other one that is quite popular is I shouldn't say quite popular. Sounds it's a little odd. Common is hormone and ovarian issues. The past, I want to say 4 or 5 years. And that's interesting because a lot of times that shows up as a queen, crown, things like that, different stages, different colors. And so I know what I'm looking at in that sense. There have been a few times I've picked up things even in animals going on. So, yeah. But it's pretty much like if you were to come to me, Bev, I would have a conversation with you first because I would want to get to know sort of where you're at. And I don't need to know that one of the things I don't want to know is a big medical history from someone because it starts to then bias. All of a sudden my logical brain starts to kick in and I want my intuitive piece in there. But I want to get a feel for how is the best way to be able to communicate with your body so that your body feels comfortable letting me know what's going on and what's happening in there. And then sometimes it would start like from head to toe. I go into a meditation, you're in a meditation, and I'm going head to toe. Some people, I'm quiet right away and I'm just writing things down. Others, I'm talking as I'm doing the work. And as I'm going in and I'm either seeing, hearing, or feeling different things. Again, it really depends on the person that I'm working with. Sometimes I'm feeling their injury, if it's a left shoulder injury or something like that. And, so I need to go deeper into what's happening there.
And as a result, so there is one part of this is the knowing. So you have some knowing around it. And then I kind of think, well, so what about that? So what happens next? What's the next step that you would take?
Sometimes I get guidance right there on what do they need to do for healing. Like I said, I ask the 3 questions. First, I want to know what ails them. Then I want to know what heals them. Then I want to know what they love, because there's that connection there, because that is going to help them move forward to heal. I pretty much just give them the information and they take it, and they'll either take it to a practitioner or maybe a different practitioner. Maybe they're going to go back to their doctor and say, hey, I want to go forward and have some of these tests. Let's talk about this. Sometimes, I do further work with them with coaching and nutrition and lifestyle change and habit change and things like that, or herbal medicines. Sometimes it's, I'm given, indication that maybe they need to see a chiropractor, an acupuncturist, or a homeopathy person. And, it's really depending on what happens there. But I try to gain as much information as I can for them. Yeah. It's not something that typically somebody needs to like regularly come back for, like a monthly reading kind of thing. It's pretty comprehensive. If we have to go into like a second hour because it's more that I need to be able to gain from them, then we do that.
Yeah. Yeah, that sounds amazing. So it's not like you said, because you've got other training, which we haven't even discussed here, is obviously the wellness coaching and also the other aspects there. So it's sort of like a number of practitioners rolled into one. So somebody could just continue their journey if they're not requiring modern medical help. So.
Correct. If they don't need to maybe have surgery, maybe surgery is the right answer for them. I know in my case, it was the right answer for me. I knew something was not right with my body. And because, life is busy and I think I know what I'm doing. The world, the universe said, we're going to give you kidney stones because you're missing something. You can see it, but you're not understanding that this is as real as it is for my own body, because it's, if I had another medical intuitive look in and see, that person might have seen something I couldn't, because we get in our own way.
Yeah.
I'm human. I get in my own way. So I had kidney stones. This is back in 2014. Kidney stones put me into a hospital. The hospital then did, the intern there kind of poked around and thought, this feels like it might be ovarian, not kidney. I said, no, it's kidney, but it's also appendix. And so they poked around a little bit more, and then they sent me in for a CT scan, and that's where they found it was in the appendix, and I had 2 types of appendix cancer.
Oh, okay. Wow. So that's sort of because you were in the hospital, because they were then, if you hadn't have been there, it may not have been investigated. Right. Yeah. Wow.
Exactly. And so I want to say I seeked out, I'm using the wrong word after a long day, an appointment with a well-known medical intuitive. And I sat with it myself after and felt that the information that direction that I was given was from this person was not what I felt okay with. And I felt okay. I knew I needed surgery. I knew that. So that's what I went with. And in the end, that was the right decision for me. So even if I'm giving direction to someone, I want them to feel comfortable with, they have options. It's their decision. It's their body. The other thing I want them to work on is, as they are going through the process with me, envisioning what's happening with them. While they're in a meditation, I ask them to also ask their body the same questions, like what can they feel? I want them to be in tune with their body too, to be able to sit and do that, and meditate regularly, and just, people always hear that phrase, listen to your body. Yeah, it's telling you things.
And that leads me to the question that, yes, it's always wonderful when you're at a certain point and you need external guidance, but we do have that inner wisdom that you're talking about. So is there any simple tools that you could recommend that listeners could practice, that enhance that connection with their body and its signals?
Yeah, I'm going to say really easy, but at times in life, like now with the world being in a lot of chaos and our lives are turned upside down, pretty much globally, I'm going to say, just even if you go for a walk and just, start head to toe, how's my hair today? Do I have a headache? Do I have this? Do I have that? Like, not in a negative way, but you're sort of, if you close your eyes and kind of like run, as I'm closing my eyes, I'm doing this. I sort of like, it's like if you picture water running through, like, what does that feel like? And doing things like that, like you're just spending, even if it's 5 minutes, nothing else on, it's just you and your body. And, you'll start to kind of see what feels off for you. And nothing's that we're not going to feel 100% awesome every day, so they're going to be some little quirks that are off, but to just stay in tune with it. Maybe it's just stretching that someone needs that day, but you don't have to sit down for like an hour every day and, do this amazing meditation. I think just really a walk outside is a great thing if you can do it.
And without your earpods and devices.
Yes, exactly.
One with nature, probably barefoot and grounded,
If you can, I mean, there's times of year, like I live in the Northeast in New England. I'm not going outside barefoot. It's cold, but I do love to be barefoot. But to find what works for you, for some people, listening to their body, I know a lot of women will dance. And they just start doing that, or even yoga or anything like that. And all of a sudden you're shutting out the external world and you're just in your body. Like, my thing is running. I'm not fast, I'm slow, but I love running and hiking. And at first I'm cranky. The first mile is like, what am I doing? What am I thinking? Do I really want to be doing this? And my breathing gets in motion, and I'm feeling my body more, other than just feeling uncomfortable. And then I get in a rhythm, and all of a sudden I'm in my body, you know? So
that's a good idea. Yes, I think keep it simple, really.
Absolutely. And that's part of when I ask, what do they love? There's going to be pieces in there that I'm going to be able to help them fold into what's going to work for them to be able to connect better with their body.
Okay. Mm-hmm. Brilliant. Yeah. And so in closing, what are your tips for living fabulously, Karyn?
Ooh. Good food, great company, know when you need your alone time, because we all need that to check in. Take care of your body. I'm really one with like exercise, meditate, fresh air, all the basics, and just love, you know, spending time with the people that you love, that you care about, and meeting other people, sharing your gifts, lots of things. Mm. Things that are the most simple, basic parts of life, to me, are absolutely the most fabulous.
Brilliant. Thank you for that. And you can find Karyn Bender at her website. It's karynbender.com. It will be in the show notes so you get the correct spelling. Mm-hmm. And then she also is on Facebook with a very long list of credentials in the thing, so I won't read that one out. But Karyn, thank you so much for sharing this insight and inspiring us to really, I feel like the message here, the big message is you have that wisdom. Give yourself the time and space to connect. Exactly. And when you have, exhausted your own resources, and there are symptoms that seem unreal, that you can't get a handle on what those things are, then seek out somebody like yourself who does that from a medical intuitive point of view. I do it from a slightly different point of view, because I actually have a symptoms questionnaire that actually leads me to a number of very common problems. So I would love to develop my intuition to your level. But right now it's working incredibly well, because I can actually even pinpoint things like parasites, other things you mentioned, thyroid problems, and because I am dealing with women with unexplainable exhaustions that a good night's sleep doesn't fix. So obviously you've got to get the sleep right. You've got to get all those basics right that you mentioned. But beyond that, sometimes there are contributing things, and often you'll go to have some tests and they don't show anything, or the doctor will believe those numbers are in range. So then you kind of think, well, it must be in my head. And you talked about psychosomatic stuff versus what's real. I mean, if you have sat with your own body, and you will know that whether something is actually feeling that way because of perhaps unexpressed emotion or not speaking your truth. A lot of women who do have thyroid issues have an issue with speaking their truth. So it's really often the symptom in the body is related to a behavior, an emotion, a spiritual deficit, a number of different things. So thanks so much for bringing this all together, and knowing that we've got people like you in the world that can help us take that next step. Because you're right, when we've got to the limit of our capacity, sometimes and like you even seek out other people to support you. So thanks so much.
Absolutely. Yeah.
Thank you for being with me today on the show.
Thank you. This was wonderful. Thank you for having me.